So my name is Dave Thut. I'm an orthopedic surgeon at Seacoast Orthopedics. I specialize in sports medicine, which is mostly shoulder and knee injuries, but also all sorts of sports injuries. Board certified both in orthopedic surgery and in sports medicine. So the goal tonight is to talk about sort of changes that happen to the body as we age and how those affect us as athletes and as trying to maintain the exercise regimen that is easier for some of us to maintain than others. So just a little bit about me. I ended up, I actually grew up in Baltimore, and I ended up back here in New Hampshire after having gone undergraduate to Dartmouth College. I spent 4 years down at the University of Pennsylvania in Philadelphia, and then some time in Rochester, New York during my training. I served in the Navy for 7 years as an orthopedic surgeon after that, and then did a subspecialty sports medicine fellowship at Hospital for Joint Diseases in New York. And then I've been here for 4 years, remarkably enough. It's almost as long as I've lived anywhere else in my adult life, which is amazing. So the injuries to people that are aging is an important topic not only to each of us as individuals, but as an important topic to our country as a nation. The baby boomers that are just sort of coming into sort of senior citizenhood have on average had a more active lifestyle than the generations before them. They've been more universally involved in sports in general. They have tended to develop a no pain, no gain mentality and sort of more strictly sort of sports thought process than probably the generations before have. And as a consequence, they've had years of sports participation to develop an accumulation of injuries that has happened over an entire lifetime, an entire career. And when you add those vulnerabilities to the fact that just getting older makes you more vulnerable exercising and makes your tissues a little bit more vulnerable to injury, it's a combination that is a little bit daunting in terms of what it means to us as a population. So over the course of the last several hundred years, the human lifespan obviously has grown dramatically. In 1796, the average lifespan was 25 years. By 1896, 100 years later, it was 48 years, and here we are just over 100 years after that, and the average lifespan is 79 years. And if you're fortunate enough to live to 65, you're likely to make it to almost 85. So what that means to us as a country is not only are we getting larger as a population, but as recently as 2008 of our population was over the age of 65, and by 2030 that's likely to be a fifth. So the preponderant or more and more people fall into this category of more mature, older people who have more proclivities to injury, and as that's happening, we have a generation of people who are doing putting more effort into staying active and staying fit. So injuries in this population are likely to be more and more of an issue as time goes on. So sports injuries overall can be divided into acute injuries, which are broken bones, things that happen because of a collision or because of an acute trauma, and then overuse injuries, which are repeated small injuries from either using your body more than it's ready to prepared to do, or asking of it things that it really can't handle. And so we'll divide those two things and talk about them individually. So acute injuries in the older population are very similar to acute injuries in the younger population, with the exception of the fact that your body's a little bit more prone to those injuries. The biggest issue, interestingly, is that older athletes tend to use less protective gear than younger athletes. So it's much more common for somebody over 65 to be riding their bike without a helmet than it is for somebody who's 30 to be riding their bike without a helmet. Same thing's true for basically all different types of protective equipment. So acute injuries, interestingly, are more common in older people for, given the same amount of time participating in a sport. Those injuries can be more common and more severe. But what we're going to focus on is the more chronic injuries that build up, the sort of overuse injuries. And that's been sort of globally referred to as Boomeritis recently. It was popularized by this guy, Dr. Denubile, who's down at University of Pennsylvania and has talked a lot about this. And basically this falls into tendinitis, bursitis, arthritis, which is a wearing of the joints, sprains and strains. And then let me just briefly talk about what he describes as fix-me-itis, which is, we won't really get back to, but is important in that it's sort of part of what's happened to our medical system in general, and part of what people talk about in our medical system is that we don't do as good a job in general of preventing things as we do at wanting them fixed. So a lot of these things that come on as we age and try to stay active are things that if we did an ounce of prevention, it would be worth a pound of fixing it later. So trying to change our mindset so that we're preparing ourselves for exercise and maintaining exercise and preparing ourselves for it should help with a lot of these things. So as we age, all of our body systems go through some sort of a decline. So cardiovascularly, in terms of our heart's ability to pump, our work capacity decreases. Even if an in-shape 60-year-old is unable to do as much as an in-shape 20-year-old, that's common sense. Our lung capacity decreases, the ability to move oxygen from our lungs into our blood decreases. Kidney filtration, so our kidney function decreases, so the ability to move the harmful chemicals after exercise out is decreased. Your nervous system, in terms of your thinking and in terms of your reaction time and your motor control isn't as good as you get older, so people have trouble with balance and those sorts of things. Your hormonal balance changes, so there's changes in terms of body composition, body fat and muscle tone. And vision tends to decline, so older athletes are a little bit more, the people on the bike as an older athlete may not see quite as much and see the world around them quite as much as a younger athlete would. So all those things obviously impact the ability to exercise safely. But what I want to focus on as an orthopedic surgeon is the musculoskeletal system, so the bones and joints of the body. So your skeleton and the musculoskeletal system you can think of as the structural framework of your body. It's the thing that holds us up. It's what allows us to move around. It's what allows our muscles to have something to act against. It's what protects us from injury from the outside world, from trauma. And it's what allows us to stay upright and move around. So the musculoskeletal system, all the tissues in the musculoskeletal system have collagen. And collagen is almost like a fiber. So you could think of it as the horsehair in old horsehair plaster, or you can think of it as the fiberglass cloth in a fiberglass, something that's made out of fiberglass. It's the underlying structural material that gives all of our tissues some strength. There are some different types of collagen. There's, I can't remember, 7 or 8 different types, but basically it's a fiber that's designed to help transmit loads around in our body. And then around that is what's called an extracellular matrix. And that's all the stuff that our cells create that gets packed in around that mesh of collagen. So if you think about horsehair plaster in a wall, there's the horsehair and then there's hard plaster that holds all that together, and the horsehair keeps the plaster held together. But if you were to put something that was more rubbery in amongst that horsehair plaster, it would be flexible, but it would still have that underlying fiber in there to help hold it together. So in bone, you incorporate calcium or hydroxyapatite, and that gets packed in. The calcium molecules get packed in around the collagen fibers, and it gives you compressive strength, and it allows the bones to hold you up so that they don't collapse. In muscle tissue, there's different kinds of fibers that get put around the collagen in order to contract and be able to pull on things. In tendon and ligament, which either connect muscle to bone or bone to bone, there's tissue that goes around that just is purely keeping it from pulling things apart. And then cartilage on the surfaces of your joint is largely made up of collagen, but then what's packed in around that collagen is functioning to make your joints smooth and have them glide nicely. So it's similar kinds of tissues all the way along. And in all of them, as you get into young adulthood, late teenage years to kind of your mid-20s, you're building up the strength of all those tissues. And by the time you get through your mid-20s, overall, the things are breaking down. So you have pretty much maximum function of all those tissues by the time you're in your mid-20s. This picture didn't come out real well, but basically, this is on the surface of bone. So this is bone down here. This is the surface layer of the bone called this cambium layer. And each one of these little black dots is a cell that's in there, and it's making all that extracellular matrix, each one of those cells. And when you're young, so this is in a rat or a mouse. I think it's a rat. So a 2-month rat, which is analogous to us in our late teens, has this thick connective tissue and has all these black cells in there. And with each passing month or each passing year, the number of cells that are in that tissue decreases and the thickness of the tissue decreases. And so the reason the thickness of the tissue decreases is because the cells aren't there making all that extracellular matrix and the stuff that keeps everything held together. So again, the structure of that matrix is critical to maintaining the health of all these tissues. And most of the diseases, the musculoskeletal diseases associated with aging, have to do with that matrix not doing what it's supposed to do. So not only does the matrix age, but the collagen itself ages. So those fibers that are really strong and stout and long when you're young, as you get older, those fibers become less resilient. So if you think of skin in a young person, that you can pinch that skin and it goes right back down, and you think of it in an older person, it's more prone to tear, it's less supple, it tends to sort of be thinner, and all that is due to decreases in the collagen. And the same thing happens to all those other tissues that are collagen and extracellular matrix dependent. In the same way that you can sort of see it in skin, the same thing's happening to tendons, ligaments, bones. The other thing that happens, we all know that our circulation gets a little bit less robust as we get older. And so the blood supply that's supposed to help those cells get nutrients in order to supply all that extracellular matrix is less strong. And so what that means is that not only is there less blood coming in, there's fewer capillaries that are allowing nutrients to get to the tissues. And so that impacts the ability of those tissues to recover. So they start out, as you get older, they're not only weakened because their collagen's weakened because they have less strong extracellular matrix, but also have less ability to heal, largely because they don't have such good blood supply. So I want to just talk briefly about each one of these sort of 5 major structural components of the body. And I want to use some specific examples for some of those things. And then at the end, talk quickly about how you can exercise in a way that helps protect those. And then if there are specific topics that I didn't touch on, I'd certainly be happy to go through those. So the way the musculoskeletal system works, most of us know this, is that the bone, again, is the structural piece. And then what causes that to move is the muscle. So the muscle is actually what contracts and sort of pulls on the bone. And the thing that connects the muscle as it pulls on the bone to the bone is tendon. So the muscle shortens, pulls on the tendon pulls on the bone, and that bends your elbow. And then there are ligaments, which are made up of very similar material to the tendons, but the ligament's job is to keep the bones together. So that connects between the 2 bones. So those are the 5 big structural elements, and again, they all have the same sort of basic components. So as you age and your bone becomes less dense, the disease entity associated with that is osteoporosis, but all of us lose bone mass as we get older. Articular cartilage, which is the surface, I forgot to mention that the other thing that's here is the smooth surface of the bone is the smooth surface that allows the joint to glide, and that's called articular cartilage. So articular cartilage, as it wears, is arthritis. Tendons are prone to tendonitis and can actually tear or rupture, like Achilles tendon ruptures or rotator cuff problems. Ligaments you can sprain, and muscles can have a strain where they get injured. So all those things are injuries. So if we go through individually, muscle peaks in terms of both the muscle mass and the power that it has at about between ages 25 and 30 about. And then starting after 40, you lose about 10% of your muscle mass with each year. And after 50, you lose about 15% of your muscle mass each year. And you lose both muscle mass and power. so that muscle becomes more fatigable. Sorry, Blitzer keeps paging me. So the other thing that happens to muscles, it becomes less flexible, and so is more prone to get stretch type injuries. Fortunately, both of this can be improved with strength training, both endurance and strength training, but strength training tends to do better than endurance training does in terms of maintaining muscle mass. So the things briefly that you can do to protect the muscle when you're exercising is to warm up every single time and make sure that you sufficiently stretch before exercising. We'll talk a little bit more about that. And then give the muscle time to recover after workouts. So your bone mass peaks at about the same time frame in your mid-20s, and then the amount of calcium that's in your bones tends to decrease over the rest of your lifetime. So your bone is made up about of 30% collagen, which is that connective tissue, the fibers again, and about 70% of the cement sort of calcium that's packed in around it. So as you lose collagen, the bone becomes more brittle, and as you lose the hydroxyapatite or calcium, the bone becomes more likely to break because it can't stand up to compressive loads. So again, that just decreases over time and makes people more prone to having injuries. So the risk factors associated with osteoporosis: age. The older you are, the more likely you are to have it. Endocrine abnormalities, like people with thyroid problems, can be more prone to osteoporosis. All kinds of chronic diseases affect your bone mass. Diet issues like low vitamin D, and actually people that are particularly thin can be more prone to it. Alcohol consumption, and then the easiest ones to sort of change and combat are the alcohol consumption, smoking, and the inactivity or immobilization. So relative inactivity decreases your bone mass. So as I said, so prevention: don't smoke. Weight-bearing exercise helps build it up. Vitamin D and calcium are important in your diet. Soda consumption is a problem. This is a problem, at least currently, more in young people that probably aren't reaching the same bone mass that they might have because the phosphorus and calcium actually blocks. The phosphorus in soda blocks the calcium absorption. So you can then decrease your your alcohol consumption, and then women particularly should have DEXA scans, which measure the density of their bone. So having decreased bone density increases your chances both of an acute fracture or broken bone if you have one of these acute traumatic type things like falling off your bike or run into something, but it also can lead to what's called stress fractures. And these are, if you picture the bone if you picture a paperclip as your bone, if you bend that paperclip enough times, it'll break through. The reason your bone doesn't do that is because there's cells coming along behind called osteoblasts and building the bone back up and keeping that calcium packed in there. So the little micro breaks that happen as you run or as you walk are getting filled in by those cells whose job it is to do that. But as your bone becomes more weak, you're more prone to having those micro cracks in the first place. And as we talked about, those cells don't do quite as good a job of coming behind and healing those little micro cracks. So you need to be careful about stress fractures as well. So tendons, which again are the connection between the muscle and the bone, tend to weaken with age. Early in life, they have a little bit of a spring to them, a little bit of a give to them. And then later on, they get more brittle, almost like that skin that doesn't have the same turgor to it. You can think of it almost like a rubber band. As the rubber band gets older, an old rubber band, you can't stretch it out, it's going to break. And the same thing's true of tendons to some extent. And I think it's worth looking at the rotator cuff tendon as an example, because that's a place where a lot of older people, and particularly more mature athletes, have trouble with that tendon. But the same ideas and problems that tendon has are similar problems to Achilles tendons and biceps tendons and other tendons around the body. So the shoulder is actually made up of 3 joints. There's the joint between the collarbone, the clavicle, and the shoulder blade. There's a joint between the shoulder blade and the chest. There's a joint between the shoulder blade and your humerus, which is your upper arm bone. So there's actually 3 joints there. They move, as you move your arm, about 2/3 of the motion happens in the ball and socket joint, and about 1/3 happens by moving your shoulder blade on your back. So there are some ligaments that connect the ball to the cup. And then there's the muscles of the rotator cuff. So the rotator cuff is 4 muscles that start out on the shoulder blade, and they come and then they go muscle, and then the tendon, and then they attach on the humerus, on the upper arm bone. And there's 4 of them that go around from front to back around the shoulder. And as you get in the end game, if you get tendonitis or irritation around that rotator cuff, eventually you can have that rotator cuff tear all the way through. So this is a 3-dimensional model of the shoulder, and you can see that this is the top muscle of the rotator cuff right here. So this is the front muscle called the subscapularis. This is called the supraspinatus, which is the top muscle of the rotator cuff. And this doesn't show it as tendon, but really this area right here is tendon. The things that are important about that tendon is we talked about blood supply, we talked about tendon weakening. Not only does that tendon have the structural issues of the tendon losing its extracellular matrix and losing its intrinsic strength, but there's an area right here, right where that tendon attaches to bone, that has relatively poor blood supply even when you're young. So that's an area that's prone to injury even in young athletes, and the older you get and the more that blood supply breaks down, the less well that area heals. So as you start to lift your arm there, that top muscle, that supraspinatus, is lifting the arm up. And so it's putting strain on that tendon as it lifts the arm up. So the muscle's pulling on the tendon, which is pulling the bone. So this is a view looking at that tendon as it's actually breaking down. I don't know how well that projects, reasonably good. So that tendon, a normal tendon there, looks shiny and white and smooth. And the surface of this, you can see all the little fibers that are all sort of part of those collagen fibers are starting to fall apart because that matrix that goes around it and it's supposed to keep all those fibers all packed together isn't working as well as it should and isn't healing as well as it could. And so what happens in that rotator cuff is that tendon continues to get pulled on and continues to get pulled on as you lift your arm, and eventually it can actually tear all the way through just because that's an area where it's rubbing and getting overused as you lift your arm and is not healing as well as it could. What that ends up looking like is this. So it eventually tears all the way through. This is the tendon of the rotator cuff. This is a view looking through the scope. This is the ball of the shoulder joint, and this tendon used to be attached right down here and has detached itself just from overuse and wear and tear. And that's something that structurally can be repaired, but would be preferable not to get to need to this point. So the way you repair it is you put some little anchors that go down into the bone in the place where that tissue is supposed to be, pass some stitches through the tendon and tie it down to the bone. And then the hope is that once it's tied down to the bone like that, it'll actually heal to the bone. Unfortunately, the same structural problems that made it tear in the first place still exist and give it trouble with its actual potential to heal. So the same idea about that tendon getting strained by muscle pulling and not able to recover as well is a problem, as I said, with Achilles tendons. Achilles tendon ruptures are very common as we get older. Tendons at the end of your thigh muscles, your quadriceps tendon, the tendon underneath your patellar tendon, underneath your kneecap, which is called your patella tendon. So all those tendons are prone to the same kinds of problems. So ligaments, which again are the tissues that go between bones, are also prone to injury, and as they weaken are more prone to injury. So sprains of ligaments we describe as grade 1 to 2 to 3, and a grade 1 is a ligament that got stretched, and a grade 3 is a ligament that got completely torn, and grade 2 is somewhere in the middle. So the classic example of this is an ankle sprain. So this is the outside part of the ankle, or the fibula. This is the foot, and there are a number of ligaments that go between the bones in the foot and the bones in the ankle. And if you roll your foot over, if you roll this over this way, it'll stretch those ligaments out and injure them, and that's more prone to happen the weaker those ligaments become. That's important. Well, we'll talk a little bit more about how to prevent those kinds of things later. So one of the last ones to talk about is the articular cartilage. The articular cartilage is the surface of the joint again. And it, at baseline, has very limited healing capacity. It has no blood supply at all to it. There are cells there that can help make a new extracellular matrix, but it really has poor reparative ability even in young people. So proteoglycan is that matrix, or the large part of that matrix that helps hold the collagen together in articular cartilage, and that decreases with age. Again, there's less of that stuff that holds it all together. So as that cartilage wears out, that's what arthritis is. And osteoarthritis is the wear and tear type of arthritis, and that's what most people have. It accounts for about 17 million out of the 20 plus million people that have arthritis in their big joints. And it's not purely mechanical, really, but the best way to think about it is as a mechanical problem. It's that the surface of the joint, that cartilage surface, just completely wears out. And it can happen as an acute injury where that cartilage actually breaks away from the bone, or more commonly as long-term wear and tear. And what that looks like. So what that looks like, again, this is a knee right here, and this white, shiny stuff right here is that cartilage surface on the joint. And you can picture that as the white, shiny stuff that's on the end of a chicken leg. That white, shiny surface is the cartilage surface, and that's what wears out as you get that arthritis. So what happens is that the surface of the joint there actually wears away. And what that looks like when you look at it on X-ray, the normal cartilage surface of the joint is not visible on X-ray because it doesn't have calcium in it, but this is the cartilage surface between the bones. So in a normal knee, there's nice cartilage surface in there. As that cartilage wears out, what we see on X-rays is that the surface between the bones slowly wears away and the bones end up touching one another. So that's when people talk about bone-on-bone arthritis. That's what that looks like. And then what that looks like when we actually look at it with the scope, in a young, healthy knee, the surfaces of the joint, so this is the surface of the end of the femur, the end of the thigh bone. This is the top of the tibia, which is the shin bone. And those surfaces, just like on the end of a chicken leg that you're used to looking at, are shiny and white and smooth and slippery. This is an instrument, and then this is the meniscus, which can also have an injury to it. But what happens with arthritis is that surface just wears away. So what you can see, again, similar to looking at that tendon surface of the rotator cuff, is that you can still see that there's fibers associated with the little bit of cartilage that's left here on this tibia and up here on this femur. But then there's a big area here of bone where the whole surface of the joint has just completely worn itself away, mechanically abraded away. And that's what arthritis is loss of that surface of the joint. And there's no way to really replace that cartilage. There are a few things that work in young people to replace small areas of cartilage, but the larger areas of cartilage, once it's worn out, the only way there is to fix that is to actually replace it with metal and plastic. So arthritis is more common the older you get. It seems to be more common in women. Weight is an issue because it's really a mechanical process. So the heavier you are, the more strain you're putting on joint and on the surface of the joint. Genetics seems to be an issue. Early arthritis runs in families, so there probably is a genetic part to how well your cartilage is able to stand up to the abuse that you give it. Some families have cartilage that's going to last forever even if you run marathons, and some families are going to have cartilage that isn't. And then injury, so trauma to the joint can induce arthritis. If you had a ligament tear as a kid, or your kneecap dislocated and actually chipped some of that cartilage off, all of those can cause cause early wearing out of the cartilage. So again, it tends to worsen with time. Once it starts to wear away, it tends to continue to do so. The time course is variable on that, though. Again, probably dependent on both how much wear you put on the cartilage and how strong it is. Interestingly, there's very little correlation between the level of pain and how much that cartilage is actually worn out. So we see people that come in with horrible pain in their knee that's probably arthritis related, and x-rays that actually look reasonably good. And we see people that have the x-rays like I showed there who really don't have all that much pain. It's interesting that it doesn't necessarily correlate. So the modifiable things associated with arthritis are obviously weight loss, obesity. So the heavier you are, the more strain you're putting on the joint. Joint injury, so both being careful to not beat your joints up too badly, particularly your knees and your hips, and early treatment if you do hurt them are important. So poor conditioning, the joint surface really does better when you're better in shape than it does when you're relatively immobile. And then wear and tear is, as we talked about, the cartilage wears out. So avoidance of overstressing it and putting too much strain on the cartilage is important. So all of these tissues that we've talked about that weaken with time and become more prone to injury with time, interestingly, are strengthened by exercise. So the number one thing that you can do to prevent the injuries that we're talking about and prevent the predisposition to injuries that we were talking about is to maintain your physical fitness as best that you can. So not only does the exercise help prevent these injuries, but actually helps recover from the injuries. So tendon injuries, one of the most important things you can do with tendonitis is to strengthen the muscle associated with that tendon and do it in the correct way. Regaining muscle mass will help not only prevent injuries that are associated with acute injuries, but will also help recover the bone mass and help recover the tendon strength. And continuing to exercise maintains your strength and balance so that you're less likely to have falls and things that would cause injury to the bone itself. So exercise improves the flexibility of your muscles, helps keep your weight down, strengthens your muscles all the way around to help prevent the arthritis that we talked about, decreases fatigue. Obviously, cardiac fitness is important. So if you're not exercising, what sort of exercise is important? And it's certainly important to maintain the range of motion of your joints. So simple stretching exercises to keep your muscles and your joints stretched out are very important. You should do some sort of weight-bearing strengthening exercises every day. And then aerobic exercise, we all know that 20 or 30 minutes at least 3 times a week of aerobic activity to keep your heart rate up is important. So if you haven't been exercising, you should begin slowly. There's a rule that you shouldn't increase by more than 10% a week. So if you are planning on starting to walk, you should walk an amount that's comfortable and then build that up relatively slowly. Don't go out and walk 10 miles the very first day. You need to make exercise a part of a regular routine so that your body is used to it and prepared for it and responding to it. So all the cells that are able to produce that extracellular matrix that we talked about will respond to a slow progression of activity so that you can build up the tissues as you build up your ability to exercise. So listen to your body, don't ignore pain. Pain is the thing that your body gives you when you start to have an overuse injury. So if you're starting to have problems with a tendon, your body's going to tell you by telling you that it hurts. So you shouldn't ignore the pain. And most pain that are associated with overuse issues can be, number one, treated with the appropriate exercise. A trainer or a physical therapist can help you develop a program that works through the pain, but also can help you lay out a program that hopefully will allow you to exercise without that pain. So it's important to stretch, warm up briefly, take a quick, do something to get your muscles loosened up so that they're not like that rubber band that's just totally dried out and worn out. And then once you've done the little bit of exercise to get the blood flow to your muscles, you should stretch them. And as you stretch, you shouldn't feel pain as you stretch the muscles, or at least a minimum of stretch. You should hold the stretch for a good period of time, like 30 seconds, and sort of relax into it. Don't bounce on your muscles as you're stretching, and make sure you stretch both sides equally. Then again, the overuse injuries in general, you should, if you start to have any kind of discomfort, you should reduce intensity of the exercise, and hopefully that improves things. Warming up before, as we talked about, icing afterwards, and working with a coach or trainer or therapist to make sure you're doing things appropriately is important. And then you should come to be seeing a doctor, either a sports medicine specialist or your primary care doctor, if your ability to play is substantially decreasing, you're having pain, obviously if you have a lot of swelling or deformity, or if you're limping and not able to move as well. Those are all signs that there's something that probably could be taken care of relatively straightforwardly. So the goal is to keep everybody as fit as possible, keep everyone active, and that activity maintains the strength and the strength of your muscles and your tissues at the same time that it keeps your overall health in line. So does anybody have any specific questions about specific issues? No? And that's that. Thanks for coming.